Delegate Smith, the effect you mentioned of the 3% increase in temperature, 3-degree increase in temperature in Maryland being exacerbated by urban heat islands. Do you have any rough quantification of how much beyond the 3 degrees the urban heat island effect can take a neighborhood?
Thank you so much for the question. So the city of Baltimore has, over the past century, seen a 3-degree increase, but that's larger than the average across Maryland as a state, and also it's about double the national average for the country. And so that's pretty alarming for the communities I represent, particularly because, as you've noted from some of the other testimony and responses, when you do not have a lot of green space nearby, it makes it very difficult to cool. Personally, when I lived at the top of my district, I did not have central AC. I was in another home almost 100 years old, but the trees were mature, there was grass all around, and I could just put a fan on and be relatively comfortable. But one of the things that makes row homes great in the winter is that they trap heat, which is good in the winter. However, in the summer, and now that I live in a row home, it can be incredibly hot. And these are communities, quite frankly, there's been research to show that the same communities that were impacted by redlining are disproportionately the overheated parts of a city presently that are experiencing the urban heat island effect, and my communities are no different from that. So communities that were redlined are less likely to have trees in them. And as many of us know, it takes a while for a community to get the full benefit of a tree, right? And so we need to make these investments yesterday. And I know that just in the past few years that we've seen tree plantings in my part of East Baltimore, you're seeing more comfort for those that are situated nearby. But quite frankly, if we do not simply provide more green attributes to communities like the ones I represent, you can have all the AC you want, but you're really not getting to the root of the problem. We can't be resilient and we can't reduce emissions if we're not looking at some new avenues.
And your constituents in urban heat islands are likely to turn where for health care? To federal programs?
Absolutely. As a city, approximately 60% of residents in Baltimore City are on Medicare or Medicaid, and particularly the communities that are closely situated near me in East Baltimore. These are some of the communities that have some of the lowest life expectancies in the city. So even though they have proximity to world-class healthcare at Johns Hopkins, it doesn't mean they always have access. And so yes, federal programs are instrumental and often under strain when extreme heat and other challenges present.
As we saw in Oregon and Washington, where they've had to actually revamp Medicaid programs to address with the risk after the heat waves out there, the deadly heat waves out there. Dr. Moretti, last summer was the hottest August on record in Rhode Island. How did that play out in your emergency room?
So, thank you, Senator, for the question. We're struggling. Healthcare is tenuous and has not recovered since COVID. I think that we saw how fragile our health system can be with COVID-19, and I am concerned as we continue to see more climate hazards to what this will do to the healthcare system. Last summer, the emergency department was full. My bosses were on local television asking patients to seek care elsewhere whenever possible because we were struggling to treat the patients that showed up to our door. We were seeing patients in waiting rooms. We were seeing patients in hallways. This was exacerbated by the heat, and it's worsened by poor staffing since COVID, and I am concerned what will happen as we continue to see increased climate hazards. In emergency medicine, we define a disaster as an event, such as a climate hazard, whatever it may be, that overcomes our resources. And right now, the healthcare system nationally is perpetually on the edge of a disaster.
There have been, roughly speaking, 2 ways that the reporting about health harms from heat have been quantified. One has been to look at the actual diagnosis or the cause of death report and pick out the causes that reference heat. Separate from that, in Rhode Island, by Brown University, as I recall, and also out in California and perhaps others, there have been studies that looked at the statistical coincidence of various morbidities and mortalities during heat wave events. And then looking at those additional deaths and illnesses and going back and seeing, could that be correlated? Could you talk a little bit about what that second round of inquiry has established? And then I'll turn to Senator Van Hollen, it looks like.
Yeah, thank you, Senator. So because heat impacts health through many different mechanisms, we cannot only look for heat stress or heat stroke within the medical records. Similarly, the patient I talked about who suffered heat stress working in construction, it's very likely that in his hospitalization, his diagnosis was coded as rhabdomyolysis and acute kidney injury with no mention of heat. So even as clinicians, when we know heat is playing a factor, it may not be coded correctly within the medical records. So when we do the second methodology that you're talking about, when we look at a population level and look for increases in hospitalizations over all diagnoses, we see much greater effects, up to 37% increase in visits, which is missed in that first mechanism of only pulling out diagnoses of heat illness and heat stress.
So the statistical method is more reliable.
It captures a larger patient population. However, that does not allow us to look at individual patient characteristics.